Subscribe for more videos. Only a fifth of countries provide sick pay. The big challenges for work in a pandemic. Sharon Burrow, General Secretary of the ITUC, shares her thoughts on the exceptional challenges facing the world's workers. A lack of access to health care and paid sick leave are among the concerns. Job losses are set to exceed predictions of 25 million worldwide. Making sure that sick people get the care they need and don't infect others is one of the key planks of containing COVID-19, but the majority of the world's workers have little choice about putting in a shift, even if they feel unwell. This is one of the worrying findings of a survey released by the International Trade Union Congress, which surveyed its members in 86 countries around the world to monitor government and employer responses to the pandemic. According to the study, only 21% of countries are providing sick leave for all or some workers. The countries polled represent a swath of the world's most powerful economies, including 28 out of 36 OECD countries and 15 G20 countries. Reflecting the severity of the situation, over half of all countries surveyed, 53%, were containing the spread of the coronavirus with national lockdown measures such as the closure of schools and non-essential businesses. This unprecedented situation is sending shockwaves through the world of work. To soften the blow, governments were most likely to opt for the 5 policies below. According to the ITUC, provision of free health care, 50% of countries' employment protection for those self-isolating, 34% of countries' tax relief for businesses, 31% of countries' paid sick leave for a period of self-isolation, 29% of countries' bailout funds for business or sectors, 29% of countries. Where are you, and what is daily working life like for you right now? I'm now working from home in Brussels. All our staff are working remotely except those of our security team and the occasional IT role. It's a challenge now to manage a global office of people in their own homes. The technology we have now really does play up the opportunities, but it also highlights the costs and potential risks of people being atomized from their place of work. What have you found to be the single toughest nut to crack in this situation? The mental health cost of this crisis will play out in the months to come, so I think just making sure people are connected and stay in touch is critical. And those human interactions we take for granted on a daily basis, passing someone in the coffee corner, having a quick briefing, whatever the daily rhythm might be, you don't realize how efficient those interactions can be until you're trying to manage that remotely. And for people with young children, this is an incredibly difficult time. Balancing work and family is a whole new realm of challenges. So from a personal point of view and from an economic point of view, this is nothing short of potentially disastrous for people's livelihoods and indeed for stable economies. What can workplaces do to better support parents during this time? We have to think about how to provide a mix of work and parenting that works, because children matter as well. Their mental health matters, and their need for support and activity, scheduling and even just attention is very important for their own health and development. You have to be conscious that parents can't be online and available to work 24/7. People must feel able to say, I can't work for these hours but I'm available at these times. What impact do you expect this crisis to have on the global jobs market? The imbalance of the global economy is now being felt. First of all, we should say thank you to those businesses who have kept their staff on, who have made sure that they have income security and a sense of job security in the medium to longer term. But there are many businesses who have simply taken an opportunity to lay off staff. In some cases, they are taking government support and still laying off staff. So there is a divide in the business community. There is one set of businesses who say, we need to look after our workers, and we need to work with the unions to make sure that the humane aspects of this crisis are dealt with as positively as possible. There have been joint calls to government to support people, first and foremost, workers on the front lines. Our health workers, transport workers, workers in supermarkets and related services, care facilities, schools where they're still operating. There are high-risk safety issues for workers in those situations, and we owe them a huge debt of gratitude. But beyond that, where the factories and retail outlets and services are shutting down, people often have far too little sick pay, if any at all. Wage and job guarantees are lacking. The International Labour Organization (ILO) says we could lose up to 25 million jobs worldwide, and depending on the time frame, it could be worse than that. So we have to do everything to minimize the fallout. First of all, only 50% of countries are providing free public health care. That is a glaring gap. And if that's the case in the richer world, then in developing economies where the virus is only just starting to spread, the health fallout could be disastrous. So if it's a mix of public and private testing and care, it has to be run on public health principles, it has to be available to everybody, and it must be a partnership. And where businesses have been forced to close their doors, of course not everybody can work from home. In fact, 50% of the world's population aren't connected to the Internet. Looking at the responses to date, mostly from Europe, the US, Australia and a few other countries, we have seen quite a lot of initiatives to support small businesses in particular. But when you then consider that only 21% of countries in the richer world provide paid sick leave for workers, then that's a disaster of humanitarian crisis levels. That is unconscionable. Beyond paid sick leave, people need income security. If you're not a direct employee, you're still going to need income, whether you're self-employed or working in the informal economy. We certainly need to see income support. The guaranteed packages to date have to be expanded. Then, of course, in terms of job or employment protection, only around 15 of the G20 countries have given guarantees about supporting jobs. This has to be in the next wave of measures under consideration by all governments. We've asked the G20 governments to look at measures that support workers and small businesses in partnership, because you can't just give money to businesses if it then doesn't flow to their workers. There has got to be some sort of criteria, some conditionality, and some direct investment in working families themselves. That's the best guarantee for the real economy. We need to look at the economy as a whole, taking it from the perspective of working people and their families, which wasn't done in the 2008–2009 process. Are there any countries that you feel are really getting this right? Yes, those countries who have looked at the key elements of paid sick leave and income guarantees for all workers, and what the mix of that should be. The best of those packages have been negotiated with unions in Europe and the UK. Outside of Europe, places like New Zealand, Singapore and Argentina have done a very good job of making critical economic decisions, and they have looked to be inclusive of all people. In some Latin American countries we've also seen some measures to include the informal sector, particularly those who work in farming communities. That's a very good thing. Our message is very simple: you have to look at guaranteed paid sick leave. This is a health crisis. It's different to the crisis of 2008–9. This one started with a human dimension, in the real economy, and is now spreading to the financial sector. In 2008–9 we saw the speculative economy simply spiral out of control, and that caused a crisis in the real economy. We took huge hits, there was high unemployment, and inequality escalated, but our economies didn't shut down. This is a very different environment and we need to think about the short-term timeframe. What are the package deals? We know what they should involve: support workers with income support and job protection. We can support small businesses and make sure that we're able to pick up an economic base in the medium term. But then from the medium to long term, we're going to be looking at post-Reconstruction policy frameworks. We haven't really had to deal with that since big shocks like the Great Depression or World War II, which was followed by the Marshall Plan and debt swaps. Now, of course, we need to design policies to align with investment in people and the environment. But above all, the longer-term perspective is about rebalancing economies. What we don't want is an unbalanced economy where you can't get essentials like healthcare products and food because they're produced in one group of countries and not in a balanced fashion around the world. We have to look at how to build a better economy alongside the convergent crisis of the environment, which is not going to go away. COVID-19 intersects with the underlying inequality crisis that was already fragmenting our societies and creating an age of anger along with the challenges posed by technology. In some ways, this experience will tell us what we need to do to get it right, so that people are connected and we're not abusing technology at the cost of both people's physical and mental health. These are big challenges. But going forward from the medium to the longer term, we need more social dialogue in order to design a better and more balanced economy.